right, great. Thank you for attending today's webinar. Good afternoon, and on behalf of the Bell Policy Center and Colorado Gives Foundation, I wanted to thank you all for joining us. Today's webinar is on intersections, housing and childcare, health, education, and workforce. And this is the second webinar in our Jeffco Housing Webinar Series. We're really glad to have you with us. My name is Julie Pico. I am the Director of Strategy and Operations for the Bell Policy Center, and I'll be moderating today's session. Just wanted to get started with a couple of quick logistical items. Since we're using the webinar format, all participants will be on mute, although we'll have a couple of opportunities for a little bit of interaction from you throughout the session. We'll use the Q&A section for questions. So if you have questions or if there's something that is coming up for you, please feel free to share that in the Q&A section. We are recording this webinar, and we will be sharing a copy of the recording on the Colorado Gives Foundation site, and that will be ready most likely sometime next week in the same location that you registered for this webinar. And I think that takes care of all of our logistical questions. We have just under an hour for our time. So we're going to start out with a bit of an interactive activity, and then we'll spend the bulk of our time talking with our panel and answering some of your questions. All right, so for our interactive bit, we're going to use a tool called Menti. So if you would like to participate, it's very easy. Just go to menti.com and you'll be asked to enter a code. The code you see on the screen, which is 1312 6122, or you can use the QR code to visit the Menti site, and that will take you to our interactive portion. We've also put that information in the chat, and the information on the code, if you need a minute or two to kind of get set and join us, will be available. Great. Let's give folks an opportunity to get started with the first question. You know, this session is all about intersections. So let's think about what are some of the other issues that really resonate for you as intersecting with access to housing. Let's see what comes up in our word cloud. I know some folks are still joining. Ooh, lots of interaction with transportation, definitely. Great. Yeah. Education, income and affordability issues, absolutely. Student housing, racism, definitely a big intersection with housing access. Childcare. We'll get into some of these issues as we move through the webinar. So let's move to we're going to do a couple of quiz questions for our next piece. All right. If you want to press enter to start the quiz. Yes, and you could answer fast to get more points. So which amount is the annual starting salary for a teacher in Jefferson County Public Schools? We have two choices. Is it, oh, everyone has voted. Excellent. Okay, so let's press enter to see the results. Yes, the correct answer was $52,625 a year. The other number, $61,520 a year, is what the housing wage is for a one-bedroom apartment in Jefferson County, this is the amount that you would need to make per year in order to afford a one-bedroom apartment and only spend 30% of your income on housing. So let's move to the next question. Go ahead and press enter to start the quiz. All right. For each licensed child care, so how many children are ages 0 to 2 are there in Jefferson County for each licensed child care slot that we have? Is it 1.5? Is it 2, or is it 3 or more? And yes, folks largely correctly found that we have childcare deserts, particularly for infant and toddler care, all over the state, and Jefferson County is no exception. Let's move on to our next one. And this is a bit of a true-false question. So which of these, pick any of these, which of these are ways in which housing options link with health? Is it that overcrowding is linked with worse mental and physical health? Is it that cost burdens mean that you're less likely to have health coverage? Is it that neighborhood connections are linked with better health? Is it several of them? Is it all of them? Wait one more second. All right, let's show our correct answer. And yes, it is in fact all of them. So we'll be getting in. So thank you for participating in our quiz section. And just kind of getting into it, why did we share these facts? We know that housing is about more than just a place to live. We know from what all of you have already shared that access to affordable, safe housing options has impacts on all the systems in which we interact. Our schools, care for young children, care for older adults, our health, and the health of our neighbors and our neighborhoods. So in our first one of the Jeffco Housing Webinar Series, we talked a little bit about some of the challenges that Jeffco is facing in our housing continuum, and especially the gap in housing for essential workers and others in our community. How our community members are getting squeezed. And we also started talking a little bit about some of what Colorado Gives Foundation and the Housing Advocacy Steering Committee has been doing to start working on solutions. So our panelists today are going to share some of the impact of housing on these other systems in our conversation. So I know you're eager to hear from our panelists. So I'm going to start by just quickly introducing you to who we have on tap for us today. So our first panelist is Lisa Stephen. She is the founder and executive director of Hope House Colorado, which is based in Arvada. Lisa has more than 25 years of experience working with teen moms. In 2003, she co-founded Hope House Colorado, and she's served as the founder and executive director ever since. She is also a co-founder of the Colorado Teen Parent Collaborative and serves on the board for the Arvada Chamber. She is a former teen mom herself and is committed to empowering teen moms in her community and across the world. Welcome, Lisa. Thank you. Our second panelist is Shelly Marquez. She is the president of Mercy Housing Mountain Plains. Mercy Housing Mountain Plains is an affiliate of Mercy Housing, which is the nation's largest affordable housing nonprofit. And Mercy Housing Mountain Plains serves 7 states, including Colorado. She leads the region's real estate development, resident services, and fundraising activities. And her team develops new housing and preserves existing affordable housing. They also provide resident services to Mercy Housing residents that are focused on housing success, health and wellness, financial well-being, out-of-school time, and community engagement. Shelley has over 35 years of experience in the financial services industry, and prior to joining Mercy Housing, she was the Senior Vice President of Community Relations with Wells Fargo. She also is a thought leader in financial health with deep expertise in asset building, particularly in communities that are underbanked. And she currently serves as the vice chair through the National Association for Latino Community Asset Builders. She also serves on the boards of Energize Colorado and the Colorado Gives Foundation, and she is a member of the Housing Advocacy Steering Committee here in Jefferson County. So welcome, Shelley. And then our last panelist is Perrine Monet. She is a policy analyst with the Bell Policy Center. Perrine joined the Bell Policy Center as a policy analyst after returning from Washington, D.C., where she earned her master's degree in public policy. She was born and raised in Colorado and is passionate about strengthening the state through engaging community in the policy process. Her work here at the Bell primarily centers around the care economy, looking at care across the lifespan and the invaluable role of caregivers in our communities. So to get started with our panel, we'll start with just sort of a brief opening statement from each of our panelists. If you could share a little bit about your work, the perspective that you're coming from, and why do these intersections matter so much? So let's start with you, Lisa.
Hi, I'm Lisa Stephen. Thank you so much for having me. As you mentioned, I'm the founder and executive director of Hope House Colorado. Hope House is a nonprofit organization serving about 250 teenage moms from across the Denver metro area. Our mission is to help teenage moms to become self-sufficient, and we do that under kind of three primary programs. The first of which we call our Empower program is sort of an umbrella over most of what we do, which includes a GED program, college and career program, financial literacy, legal advocacy, on the personal side of self-sufficiency, because we measure both an economic and personal self-sufficiency. That includes counseling and mental health supports, personal growth, parenting programming for our moms. And then our other two programs are our early learning and school age program, which is, of course, for our children, the little ones of our teenage moms, ensuring that they start school ready with their peers, and that they are receiving early intervention when necessary. And then our housing support program, which Hope House started as a residential program for parenting teenage moms 20 years ago and just has kind of expanded over the years. But we've always just had this primary, residential program that we have a house that serves up to 6 teenage moms and their kiddos at a time until COVID. And COVID was such a huge impact on the population we serve, in terms of just being really isolated in unsafe situations for a long extended period of time, that we've seen an incredible increase in the impact to housing instability, housing crisis, teen moms literally homeless. So we, in the last 2 years, have expanded our program from what we just called our residential program to now our housing support program, which has been an adventure for us. Let me say, there is so much to learn, and I'm so privileged to be a part of this conversation and learning from all of you. So we do still have our 12 bedrooms, 6-person residential program, but we are now serving about 100 of our teenage moms with a variety of housing supports, everything from some direct assistance with rental assistance and so forth, a lot of just navigating the housing. How do you navigate housing? How do you find housing? And we hired a housing navigator who is a graduate of our program and so understands our moms and their situations really well. And she is frankly, just having a seat at the table in many of these conversations has opened the door for a number of our moms to get into an apartment when a new building is going up or a new project is opening. And where I can say this matters for our teenage moms, I should also add, we are building an early learning center. So if you hear construction happening, forgive me. We will be opening a center for up to 100 children of our teenage moms and our staff in August of next year. And I bring that up because where the intersection happens for us is that you really can't, when it comes to self-sufficiency, you can't begin to make forward progress until you have a safe place to live. That's, we have automatic lights at Hope House. So you're going to see me have to wave when I sit quietly. I have to get my lights to come back on. So you really, unless you have a safe place to live, you can't make forward progress on a GED. You're not thinking about your GED or can I move on and go to college when you're worried about whether or not you have a place to sleep or whether the house you live in is going to be safe when you come home from school. So that is the starting point. Once we have a safe roof over our head, then we can start thinking about childcare and transportation and those other huge barriers to self-sufficiency. So I'll leave it there for now and back to you, Julie.
Great, thank you. Shelley, would you like to go next?
Sure. Good afternoon, everyone. As shared, my name is Shelley Marquez and I'm the president of Mercy Housing Mountain Plains. Mercy Housing is the largest national affordable housing developer in the U.S. and we currently develop, own, operate affordable housing across 21 states. In the Mountain Plains region, we have about 41 developments, and to narrow that down a bit further, in Colorado, we own, operate, and manage 16 properties, and we have two new developments coming online by the end of this year. So Mercy Housing has had a priority around health and housing, and it is one of our focus areas with programming we provide at the property level. So Mercy Housing has a site team of property management and resident services who work directly with residents addressing needs around health and wellness, housing success, financial well-being, out of school time, and community engagement. Many of the programs that we provide address the social determinants of health for Mercy Housing residents. And we do this through one-on-one case management. We conduct an annual resident survey. And when we originally meet with residents, it happens at that initial intake. What we always say is the work starts once the residents move into our property. So our goal is to get them housed and keep them housed and thriving in their environment. So, why does it matter, or, why does this conversation in this webinar matter? For me, the webinar is timely, and I don't think we can no longer just think about housing, but we need to be thinking about all the other services that impact individuals long-term. So when you think about the social determinants of health, housing is key, but without housing, it makes it very challenging for an individual or families to think about other needs if they don't have a stable place to stay. As Lisa had shared, it's really important. So if they have housing, they can then start thinking about what are my mental health needs? Do I need to access a primary care provider? What is that access to transportation? All of those things around social determinants of health really help individuals, but housing will keep them stable and allow them to focus on what are those next steps. So for my overall perspective, or when I think about this conversation, I'm a 30-year resident of Jefferson County. I'm on the board member of Colorado Gives and a housing developer across the state of Colorado. I've been connected to the community for many years, and I've seen the needs evolve over the years. I'm pleased to be part of the discussion today as we explore ideas and solutions on how we're addressing housing needs, health, workforce, and childcare, because they all intersect as we think about what you can't think about childcare without, also addressing the housing needs or workforce workforce development needs. So really pleased to be part of the conversation today.
Great, thank you, Shelley. And let's turn to Perrine.
Yes. Hi, everyone. As Julie mentioned, I'm Perrine. I'm a policy analyst at the Bell Policy Center. And at the Bell Policy Center, so we're a state-level policy research and advocacy organization committed to economic mobility for all Coloradans. And economic mobility can touch on a lot of things, but one way in which we focus economic mobility is through the caring economy, excuse me. And the care economy incorporates care across the lifespan. So it's early childhood education and childcare to care for older adults, people with disabilities, and also includes the caregivers, those that are providing care, whether that is formally or informally. And so today, I think the perspective I'm bringing is largely on the research that I've been doing across the state around childcare specifically, and the accessibility and affordability challenges that people are facing. And the research has included a lot of community engagement work with folks from around the state, and just what I've been hearing around challenges to accessing childcare. And across the board, I think, as it's already been brought up in the quiz and the interactions, is that we do not have enough licensed childcare to serve the need, and that is also true in Jefferson County. I think we currently across the state have about 67% of children are receiving care who most likely need it. And so there are many reasons that make increasing childcare availability difficult. But I think a major theme that has come up consistently in this work and in the research in these conversations is how the housing challenges that communities across Colorado are facing is limiting or is a major barrier to increasing accessibility of care and our ability to provide care in these communities. And we know that care is critically important for a community's well-being. It ensures that children are receiving the quality and consistent care. It's important for their development. It's important for parents and families to be able to continue working. And it really has positive ripple effects across our communities. And affordable housing is one way in which we can really support our childcare workers, providers, and families. And so I'm excited to share more with all of you today.
Excellent. So now that we've had sort of a first take on some of these intersections, let's dig into a couple of them a little bit more. So Lisa, you touched on housing sort of being the nexus or the central place where you have to start in order to start moving towards economic well-being and self-sufficiency. Tell us more about that. What does that look like for your participants?
Sure. So, and I guess I'll kind of put on the hat of representing the Colorado Teen Parent Collaborative, which is a collaboration of individuals and organizations across the state that serve teenage parents. And from that perspective, I can sort of speak on behalf of all of us serving teen parents across the state. So what we see happening with teenage parents is that, and again, increasingly since COVID, they move a lot. So people often ask us, you're serving 240 or 250 teenage moms and only 6 of them live in your residential program. Where are the rest of them? So the cycle that I often describe is a teenage mom or teen parent may be living with grandma, for instance, and grandma's on Section 8. And when Section 8 finds out that teen mom and her child live with grandma, suddenly they realize, oh, she has too many people living in her apartment, so teen mom has to move. So she moves back in with mom. Well, her mother, the teen mother's mother, she has a new boyfriend. New boyfriend doesn't want teen mom and baby living there, so she has to move again. So then she moves back in with ex-boyfriend, who, because she has no other choice, who was a bad choice in the first place and why she ended up with grandma. And so we just see this cycle of moms moving from place to place to place, and never for, or typically not for more than 6 to 9 months, maybe in a row. So while we often say in the Teen Parent Collaborative, what is the address? Where is mom living? That actually doesn't help us a lot because her address changes so often. She's moving around a lot, and she may even be moving across communities, which is one of the reasons the Teen Parent Collaborative was so important, because you may have a mom who lives in Pueblo and moves to be back with her own mother in the Denver metro area, and then has to move back again when mom kicks her out. So we just see this pattern of lots of movement, and therefore an inability to just gain traction in moving towards self-sufficiency. And that intersects with childcare, because every time she moves, she has to reapply for CCAP in a different community in order to get a very elusive CCAP spot in whatever county she happens to be residing in, and then she loses it again when she moves back to another county.
Yeah, we can definitely see a lot of intersections there with healthy child development, with family stability, a number of things going on there. What has it been like for, you run a nonprofit organization in Jefferson County, and have, what does this look like for your workforce?
That's a great question, because the one of the primary things that's important in the work that we do is relationship building. So our theory of change is that change happens within long-term relationship with healthy adults. Well, what happens when we have high amount of turnover, especially with our program staff, is that those relationships that have been built between teen mom and staff members that are very critical are broken, and that impacts teen mom, because she's coming to us for a safe, stable place to belong, where there are oftentimes that, like, even if somebody moves desks, they'll get flustered, like, where did Julie go? Where's she at? They think she left, and maybe she just moved desks. What we have seen just in the last 18 months, we've had 4 of our program staff members leave our employ to move to another state because they can't afford to live in Colorado any longer. And 2 have left our employ because they live so far east in order to afford a place to live, afford a home. They live so far east, like Deerfield, Hudson, that it's too far of a drive for them to get to Hope House in Arvada to work. And because we're similar to a school, the work we do is teachers are here in person. They are not working remotely with our teenage moms. They just couldn't, between gas prices and the drive, they just couldn't make it work. So we're seeing this impact where, and again, we're talking about this at the Arvada chamber level as well, people can't afford to live where they work. And so they're driving farther and farther to try to get to work. And I guess the last thing I throw in is that I loved that question about what is the starting salary for a teacher in Jefferson County, because for nonprofit, those working in the program area of nonprofit, it's a very similar starting salary, maybe even a little lower. And so that tells you that while we're trying to move our teenage moms to self-sufficiency, even if we're paying benchmark for the industry, we are often not at a level for our staff where they're really truly self-sufficient and can afford to live on their own without a roommate or a spouse or living with their parents.
Thank you for sharing that. Shelley, can you tell us, you sort of touched on some of the connections between housing and health, and particularly the social determinants of health. Can you expand a little bit on what you've seen through your work at Mercy and through your overall work in the community?
Sure. So I would say for Mercy Housing, our focus is around health and housing, and being able to get residents housed is a priority. And then we work with them very closely to ensure that they have access to primary care providers, mental health, and other resources. A lot of times what you find, we don't do this work alone. I always say it takes a village when we think about who we're serving. And so we're working with healthcare partners and other partners in the community to explore how we're addressing those social determinants of health. So some examples of the way we do that is, once someone's housed, we'll bring vaccination clinics maybe to our senior properties or family properties. We've done dental buses that where you have a provider coming to a family property and providing dental services to the families, the kids, the kiddos that are at that property. And then there's other educational resources that we provide on a regular basis. The resident service team is really assessing what are the needs, and they do that through a survey. What are the needs our residents have, and then how do we bring resources to help address some of those needs? And so I would say when we do that, when you do that type of work and you take that approach, it really does help narrow in or focus in on what are those social determinants of health. We've heard from residents, transportation could be an issue, or just accessing a primary care provider. We do an annual resident survey, and with that survey, we're looking at, has the resident had met with a primary care provider at least once in the last year? And some of that is just meeting with your primary care provider to address, preventative items, but just also ongoing health needs. So we found that this has proven to be impactful and has allowed us to help move the needle in the health and wellness and addressing some of the social determinants of health. I would also say, Mercy Housing, Inc. as an organization, we've developed over 9 properties across the U.S. where we've looked at housing and having a federally qualified healthcare center as part of that development. And so we've partnered with healthcare providers to be able to address the health and housing issue across the U.S. And we found that residents, when you have a development where it's not just housing, but you have those resources right in your backyard, it does address a lot of those social determinants of health for residents to be, transportation is no longer an issue, but they're able to connect with providers, whether that's mental health resources, dental resources, or other, just meeting with a primary care provider on a regular basis has been impactful. So for us here in Colorado, what I would say, we are looking at, we are working on a new development where we'll be able to bring housing. It'll be almost 197 units of affordable housing, along with a federally qualified healthcare center. We're partnering with the Denver Indian Family Health Services. They'll operate the healthcare clinic, bringing healthcare, dental, vision, mental health, case management services to help the resident and community at large. And so this particular development is right on a TOD site. So when you think about social determinants of health, it's really being able to address a lot of the needs that we're finding our residents have expressed and we're hearing and seeing in the community that are needed.
Great. And Lisa touched on some of the workforce issues for her staff and for others in the community who are in the nonprofit sector. What have you been hearing in terms of workforce from some of the health entities that you all are working with?
Yeah, that's a great question. And I would just say, as we are working with healthcare providers, in locally, our work with Denver Indian Family Health Services, access to affordable housing is important for their own staff to be able to, I think Lisa, her example is spot on, where individuals aren't driving 40, 50 miles just to get to work. We've had conversations with a hospital system in Durango where they've said it's been very challenging for to attract employees for open positions, and that could be nurses, it could be your the kitchen staff, or someone they are not because housing is not accessible in a high cost market. And so where they do have staff, they're driving 50 miles to get to work, and that's not sustainable long term when you think about the workforce and what that looks like. So we are looking at how can we collaborate with hospital systems and work with them to address the workforce needs with affordable housing. So a lot of conversations are happening, but it's not just in Colorado. This is happening across the U.S. when we think about what are the workforce needs. And so, in Jefferson County specifically, we have a lot of hospital systems that are bringing some amazing resources to our communities, but housing will continue to be an issue for many of them if we don't address affordable housing, workforce housing needs in a strategic way.
Great, thank you. Perrine, you have been working in with talking with caregivers around the state and with folks involved in the early childhood sector. What are you hearing about? Put some of this into context, and what are you hearing in terms of some of these connections with childcare and
Yeah.
housing?
Yeah. So, like you said, Julia, I've been talking to people across the state, whether they are providers, community members, they might be, early childhood councils. So lots of people involved in the early childhood space. And I think what comes up a lot is the physical space to have a childcare facility is really important. And I think sometimes a less obvious, but really interesting intersection with housing. Childcare takes place in a lot of different settings, and it can be in a center, but also in a home and sometimes with family members. And if you look at the licensed facilities that provide care in the state of Colorado, 46% of the licensed facilities are childcare homes. So we do have a significant amount of people providing care for children in their own homes. And, I should note that that number does, again, just includes licensed home care. And when we think about how much care we are providing, these numbers don't include children that are being cared for by family, friend, and neighbor care, or FFN, which is also often happening in people's homes, but again, in a mix of spaces and sometimes public spaces. So housing is an important space that childcare shows up. Specifically, more affordable housing provides a great path for people to increase childcare spots. Some communities have focused their efforts on trying to recruit more people to open childcare businesses from their homes as they think about, the ways that they can make childcare more accessible. Again, like I said, we don't have enough licensed childcare in the state, and Jefferson County is also experiencing that challenge with for infant and toddler care, over 3 children are needing care for every spot that is available. And if you look even for older children, there are like 2 children for every available spot in childcare. So looking at childcare homes can present sort of less of a startup cost in some ways than opening a center. But this is where the housing challenges have really impacted this potential way to increase the amount of care being provided. So our childcare providers are operating on, thin margins, and it's expensive to provide care. It's expensive for families to afford care, and so there's not much of a profit margin. And the cost of housing can really affect that and make or break someone's ability to provide care, whether it is homeownership or renting. We've just heard that, as a business cost, that is an important business cost for providers, and especially important for a childcare provider who's a renter. I think those rising costs have made housing very unstable, like you've heard from both the other panelists. And again, that instability really can make or break a person's ability to provide care, because parents and families often pick a childcare location that is near their homes or their places of work. And as someone that, eventually they tend to build a relationship with and trust their childcare providers. So, from the provider perspective, they're often having to move as well. Like, they are not immune to those challenges, and makes it really difficult to build those relationships with families and continue to provide care in these areas. And, that is also the piece that the other workforce piece is that people need childcare in the areas that they live. And if providers cannot secure stable housing, that can really deteriorate the relationship, not only with the child, which is important for their development, again, which has been mentioned in other scenarios, but also just pushes out the care providers to different locations in a scenario where we already do not have enough care. And so I think, that can make providing care in communities really unsustainable, and just can sort of heighten the issue. And I think the second intersection that, again, has already been mentioned, and I'll just quickly talk about it and let others jump in, as I'm sure you'll have more to add. But we don't have enough childcare workers either, is the main issue that has come up in these conversations. And that is very often tied back to affordable housing and just the difficulty in, providing a stable and affordable place to live for these childcare workers that are so crucial to our communities and providing care. And again, that's as you've heard, is the case for many industries and is not necessarily unique to childcare, but I think is especially true and important to highlight among childcare workers who are paid very low wages and often do not have benefits. And childcare workers report being worried about eviction and difficulty paying for their rent or housing costs and covering their costs. And again, I want to note, just for those FFN providers, the family friend and neighbor care, although it is unlicensed, that is also a very important source of care. And they also face those same housing challenges. They have higher rates of eviction or stress around not being able to make housing payments, and just have higher rates of housing hardship overall compared to other childcare workers. And so affordable housing is really important in terms of the workforce for the childcare, but also in, I think, facilitating more childcare providers and businesses being able to open and serve more children.
Great, thank you. So one of the things before we turn to a couple of questions from the audience, I wanted to have Shelley highlight a little bit about some of the work that's being done on solutions, and particularly tell us a little bit about what the Housing Advocacy Steering Committee has been working on and focusing on.
Great. Sure, I can share a little update here. So I would say what's really exciting is, like, right here in Jefferson County, the Jeffco Housing Advocacy Steering Committee created this year. They've been working together to develop core values and guiding principles. But what really gets me excited about the work of this committee, it's representative of cities and counties throughout Jeffco. I've been able to, as a committee member, it's really I've been pleased to see mayors, you have commissioners, practitioners, stakeholders who are coming together to really address the housing needs and explore ideas and solutions that allow us to move forward with policies and practices that will help address barriers and explore solutions together in addressing the housing need. Some of this work they've done, site tours of developments to really understand what's being done in this space when we talk about affordable housing, where are the gaps, how do we address the gaps? And so it's very exciting to see those conversations happening in a collaborative effort to really say, how do we move the discussion forward? How are we addressing the needs around workforce, childcare, affordable housing, and what could we do together collectively to really advance the work? And so you have a lot of committed individuals. I would just also add that, in Colorado, there are other resources that have been provided. So you have Prop 123 that is focused on middle income housing and bringing new resources to Colorado. A lot of these resources have just started to roll out, so we don't see the impact or the outcomes of Prop 123 that would address middle income housing. But in addition to that, last year at the state level, they did create a state middle income housing authority at the state level. And really that middle income housing authority is looking at, what does affordable rental housing look like? How are they able to enter into public-private partnerships to really look at affordable rental housing, and then provide assistance. So we are seeing a lot more activity, not only in Jeffco at the state level, with a couple of initiatives to really address affordable housing. And I'd like to, just go back to the comment that Corinne made around childcare and housing, and share a little bit about the work that Mercy Housing is doing. And really excited, we just opened up the Rose on Colfax, which is a new development that is focused on, it has 82 units of affordable housing along with a child care center. And I will just say this has been a development that's been in the works for the last 3.5, 4 years. But our focus there was really to bring not just affordable housing, but childcare resources. And that was based on a number of community engagement discussions and hearing from the community saying, this is a childcare desert and we need resources to really address those housing needs. And so not only affordable housing, but childcare. And so our work as a developer, our expertise is to develop housing. We don't do childcare. We're not a childcare operator, but we partnered and collaborated with Mile High Early Learning, who will be the operator of the childcare facility. That's their area of expertise. But where our partnership came in is to make it affordable and sustainable long-term. We did a capital campaign on the front end to raise money that would help draw down or bring down some of those costs so that an operator like Mile High Early Learning could operate at a facility like the Rose at Colfax long-term. And so it does require maybe some innovation, there were a number of partners that provided additional funding resources to make this development happen. And I know at the state level, they're looking at how can we do more affordable housing with childcare facilities adjacent or right on site. And so I think as we think about the needs in Jefferson County and how we address affordable housing, childcare needs, we need to be collaborative in our approach and think about who are those operators that could step in to really deliver childcare resources and then also affordable housing. So really excited about the work that's happening, at the state level in Jefferson County and opportunities to collaborate as we move forward.
Great. Well, it's always good to highlight some of the bright spots, because intersections between housing and other issues aren't just about what the need is and what the challenges are, but also how we can come together, Shelley, as you had mentioned, in terms of solutions. And then Lisa, I don't know if there's anything that you want to highlight in terms of bright spots from some of your participants.
Yeah, we have actually had, I think we're up to 12 of our young moms that have been able to purchase a home in the last 18 months to 2 years. I will highlight that none of those moms were able to do that as a single mom. We serve our moms, they come into our program between the ages of 15 and 19, and we serve them until they turn 25. So by the time they've turned 25, many of them have gotten married or they're in a healthy relationship and they're able to purchase a home as a couple. We do have one mom, Alondra, who became a nurse during her work with us here, and we supported her through that journey. And she and another nurse at Children's Hospital recently purchased a home together. So there are our participants in our programming are getting very creative in how they move forward in being able to be a homeowner. And our moms are very interested in becoming homeowners. When we hold a class to talk about how do you become a homeowner, what do you need to have in place, they're very well attended. They have a deep and innate desire to own a home and create a safe and stable place for their own children, because that's not something they've experienced themselves. And so it's a gift when we're able to get to the place where we can support them in doing that. And even though we haven't quite gotten to where we can do it as a single mom yet, we are definitely seeing it happen, and that's huge for us.
Amazing. Well, I want to make sure that we have some time to field a question or two from some of our panelists or some of our audience members. So one of the questions that we got is, I'd love to ask the panelists to comment on the housing challenge faced by adult learners who are wanting to complete a degree, get a new skill, etc., but they can't afford housing and tuition. And they note that it's very difficult to work to improve your livable wage if you can't afford to pay your rent or mortgage. Lisa, do you want to comment on that? I know some of your participants are involved in trying to seek higher education.
Yeah, I mean, I'd almost kind of pass that a little bit back to Shelley. I think when we're able to find those amazing opportunities like the Rose on Colfax, that's when you can see true progress happen, because then we are finding a stable roof over our head. We are finding childcare. Now we can focus on learning. What we find is that our moms are oftentimes dropping in and out of college. So about 95% of the moms who participate in our GED programming are moving into our college and career programming after they finish their GED. But what we find is that they're in and out of that higher education journey because of their housing issues or their childcare issues, particularly when it comes to the summer months. They're having to quit work or quit going to school during the summer months because there are as few early learning childcare spots as we have. There are almost no spots for school age children during the summer, and those summer camps, even if you can afford them, and many of them do not accept CCAP, they just sell out in like minutes. So we're just seeing a very interrupted education journey unless we are really blessed to find an option like the Roseanne Colfax.
Yeah, Shelley, did you want to comment further on that?
Sure. I would say as we're working with residents, I think our experience is similar, Lisa. Like there is it's a stop and start, and you really are trying to get residents stable. So them being housed and, connecting them with a case manager who can direct them to different resources. We also look at our properties. We do look at, asset building programs that would help an individual think about, savings, and maybe that savings could be for education. It could be for a first-time home, to purchase a home. It could be for to start a business. And so we do have a program called the Family Self-Sufficiency. It's not Mercy's program. It's a national program through HUD, FSS, that does give individuals the ability, if you qualify, to start building assets that allow you to set dollars aside maybe for that educational resources. But it really, I would say the programs and the resources are on a case-by-case basis. And, I feel like that's where our team really leans in and tries to understand what the individual's needs are, and then how do we address that with partners and resources that are available in the community so that you can keep them housed and then allow them to look at what are their goals. And they may have multiple goals, just like all of us do. That first goal may be to get a GED, and then it's to go on to college. And so how do you help them make those baby steps along the way so that they can achieve their long-term goals?
Great, thank you. Well, I think I want to thank all of our panelists for sharing your insights and your experiences. I think a lot of really fruitful information in terms of how these things work together and what that looks like, particularly in Jefferson County. So let's move on to let you know a little bit about some ways that you all can become involved in the work. Shelley mentioned the work of the Housing Advocacy Steering Committee, but there are a number of other ways that the Colorado Gives Foundation and other partners in Jefferson County are really working towards in order to start addressing housing for our essential workers, for people in that missing middle, where maybe they make too much to qualify for income qualified housing, but they are still in that place where they're not able to afford market rates without straining their budgets. And we've heard a little bit about how that affects all of the different areas of life in Jefferson County. So to learn more and get involved, Nazia Hassan is the Director of Community Impact at the Colorado Gives Foundation, and she is heading up some of the work around affordable housing. You can see here this site, which is also being put in the chat, is a place where you can learn more. We're going to be posting some resources there, some additional fact sheets. We will have the recordings of all the webinars, and we will also be, and you can also register for further webinars in our series and find ways to get involved. If you want to go to the next slide. So our next webinar will be in January. We're going to take a month off, but we're going to be digging into a little bit more of what's actually happening in Jefferson County from the perspectives of folks here in Jeffco, and thinking through that and really looking at who's feeling the housing crisis. It's all of us. So that will be on January 25th from 12 to 1 p.m. And you can again go to that site at the Colorado Gives Foundation site to register for that webinar or any of the other webinars in our series. So I think before we get to, before we wrap up for the end of our webinar, we're going to do one additional little mentee activity. And we'd so I'll give that a second to come up. And this is actually a free forum. We'd like to hear from you. What would you like to hear more about? How can we, what would you like to learn more about from the Colorado Gives Foundation, from the Bell Policy Center, from one of these webinars in this webinar series? We'll be running these webinars from January through April. And so, so there'll be lots of opportunities for learning and figuring out how to get involved. So we'll wait for responses. Oh yeah, we'd love to hear about innovations, definitely. Yes, we'd love definitely would love to talk more about what are some of the solutions. We talk a lot about what some of the challenges are, but there are really great things happening and really creative approaches to working on this. A list of housing developments that include childcare, that's a great idea. That's a great community resource because that's such a huge piece. All right, well, let's, I will wrap up for today. So thank you for sharing all of that. And once again, I would like to thank our panelists for joining us today and sharing your insights. Thank you, Lisa Stephen. Thank you, Shelley Marquez. Thank you, Perrine Monet. And certainly for more information on any of these things, you could visit one of our websites, the Colorado Gives Foundation, and also the Bell Policy Center. Thank you all for being part of our webinar today, and have a wonderful afternoon.